You're watching Capital Connection from the Illinois State Capitol.
Welcome back. Joining us now is the CEO of the Illinois Coalition Against Sexual Assault, Carrie Ward. Thank you so much for joining us.
Hi, Cole. Thanks for having me.
So I wanted to have you on today to talk about a budget ask that ICASA has right now in for the state. You're asking for a very significant increase, but it's to fill the gaps left behind some pretty serious federal cuts that your organization has had over just the past year here. Tell me a little bit about the hole that you guys are in right now.
Okay, so we faced a $9.5 million hole as a result of VOCA funding cuts. So the Federal Victims of Crime Act funding, ICASA had previously received about $18.8 million in that funding for the past several years. We were notified in January, February of last year that effective July 1, we would be cut by $9.5 million, which is, an enormous impact for rape crisis programs, resulting in layoffs, terminations, reductions in services all across the state. We had come to the state of Illinois last year once we were aware of this and asked for an increase in the budget to help address that. We did not receive an increase in state general revenue funding, and so we came back this year to say we really need to see the current line item, that's around $7.5 million, increase to $20 million. Partly because of that enormous cut in federal funding and how that impacts the survivors in the state of Illinois, but also because of the need to provide additional funding for rape crisis services in general, to allow us to provide more funding to pay the staff, a more thriving wage, to be able to address issues of attrition and burnout. The money is really needed, and we have not had a significant general increase for over 20 years.
So without this money, you mentioned reduction in services, locations closing down. What is the footprint right now for ICASA organizations, for centers that are a part of this, and what's the rollback going to look like?
Absolutely. So the rollback has already started. We have 31 rape crisis centers throughout the state of Illinois, and we have already seen 5 outreach offices close. So those are the expansion offices that we've been able to reach population centers or rural communities. So we've really had to roll back 5 of those outreach offices already. We are on pace to serve 1,400 fewer clients in FY24 than we did in FY23. We have 6 months of data so far. We already see that decrease of 700, so we're on pace to be at 1,400 fewer folks receiving our services. And we've had 15 hospitals that no longer receive the services in the state of Illinois, that emergency response service, because we don't have the funding to provide the staff to respond to those hospitals.
Part of the work you do and the people you work with is this sense of they need to feel willing to come forward with these kinds of cases, and the absence of care in specific areas. I guess the way I'll phrase this is the consistency that you had in these kinds of centers, letting people at least just know that the center is there, had to be a big part of growing the knowledge that those services are there.
Absolutely. I think one of the biggest impacts we've seen is we have been increasing services over the last several years. We've been increasing our growth to be able to show there are communities that need services that are adjacent to current communities that have services, and we're really proud of that reach. We know that there are folks that need services in their own communities and not have to travel to go receive those services. So that had been a part of our strategic plan for years, is to be able to continue to expand those services because we know the need is there. Having to pull those services back is a disservice to the communities and the survivors that we serve, and it means there are people who will go without services who may have otherwise reached out for them if they were available in their community.
You said that you tried last year and didn't get into the budget. This year we've heard about the tough line items. There is a tighter budget situation in the state. What was the reason you were given last year when we saw high levels of spending that the state couldn't spare, the extra $13 million that in this relevance of the state budget, in respect to the state budget, isn't that much money?
Absolutely. We didn't receive a specific reason as to why we didn't make it into the state general revenue budget. We know that we got a little bit of a late start with that because the notification about the funding cut came during the legislative session, and so we know there are folks who are probably ahead of us in making that ask earlier in the year, but we came when we had the information that showed we weren't going to receive that funding, and we worked really hard to address it. And so what we really tried to do this year was to regroup and say, maybe we didn't get our message to enough people, maybe we didn't get in front of enough committees. Maybe we didn't have enough of a constituent response of folks, coming out and saying this is really essential. And so that was one of the reasons for the rally that we had recently, is we needed to bring hundreds of folks down to the Capitol and just really emphasize how important this is, how far the reach is, and really try to make that impression. I do believe that we've had good support. I do believe that legislators have heard us and think that this is an important priority, but we just need to know how we can get into the state general revenue budget for that increase.
To get into those conversations you're having with lawmakers about this, is this still at the grassroots level? Are you getting in where you can, or have you had conversations with leadership about this making it into the budget?
So both things are happening. Our goal right now is for every one of our 31 rape crisis centers to schedule a day to come to Springfield, either meet with their legislators in person or schedule virtual visits. We're accompanying them on those visits. They can talk about the services that they do in the communities that they assist, and we can talk about the ask for the funding and why we need that to be able to keep those services in place. We've had an opportunity to meet with some of the leaders and budgeteers. We've reached out to Human Services Appropriations on the House and the Senate side. We've had a chance to meet with the Democratic Women's Caucus. We have been able to meet with, we had a meeting with Senator Sims. One of our senators had an opportunity to meet with Senate President Harman. We're reaching out to Leader Jahan Gordon Booth. We're really trying to access the folks that we know are in those positions to be able to help make those final funding decisions. And we've really tried to talk to every legislator and say, will you help us make this a priority? Even if you aren't a budgeteer, if you aren't on Human Services Appropriations, can you show your support for how important sexual assault services are? And we know, in response to what you're saying about the ask and budget year being tight, we know there are lots of worthy, causes. We know there are lots of people who need funding, and we support the efforts for that reach to go as far as it can. We don't come in and ask for money that we don't need. We don't come in and ask for more than what we think it takes to be able to do the service that we do. And it's been much, much too long since there's been this kind of investment by the state of Illinois in sexual assault services.
So when we talk about this money, if you said the rollback has already started, there's been services that have already gone away because of these cuts. Is it, once this money's allocated, those services can come back up? Or what does that look like if the money ends up being there?
So one of the things that's difficult is with sexual assault services, it's not like a spigot you can turn on and off. And so I think when you lose an outreach office, when you lose a relationship with a hospital, when you're no longer funding or supporting a certain community, now there's an extra effort that it takes to be able to start that again, because there's a loss of trust that happened there. And so it was really one of the reasons we really wanted to bridge last year and say, let's try to get this funding in place before the impact of that $9.5 million cut fully takes place. Let's continue these services, and we weren't successful in that. And so this year we know we've got some work to do to rebuild, to let survivors know we're back, to maybe try to reopen some of those outreach offices, reestablish relationships with those hospitals. But it'll take some work to do that, because we have to reestablish that trust that's been lost by not being there. And
you talk about the trust that's needed there. What kind of message does this send if the federal government just will cut that money out? That doesn't just impact Illinois, that impacts all the other states. And then when you come to the State House and ask for it, if you don't get it, what kind of message does that send to the survivors that you help?
Well, I think that our worry is that the message that gets out there is that this is just not important, that is not as important as it should be. And what we know at the federal level is part of this was based on the amount of funding that was available, the amount of federal VOCA funding that was available in the Crime Victims Fund. This year was only about $1.2 billion. The way it was last year was 1.9. So we were already looking at a $700 million gap across the entire nation and 6 U.S. territories. So we understand that there was less funding available, and that impacted the necessity of the cut. It wasn't through anyone or any state doing something wrong or not meeting expectations. But we also are advocating at the federal level to say we need a fix for that too. We really need to address, we can't have gaps of hundreds of millions of dollars when those dollars are being used to fund services. So we also are advocating at the federal level to say, what can we do to help reestablish some of those federal funds? And in the meantime, what can we do at the state level to help fill that gap as well? We know that the state of Illinois was not responsible for the funding cut that we received at the federal level, but it is state of Illinois survivors who need those services, and so we have to be in this together.
All right, well, Carrie Ward, the CEO of the Illinois Coalition Against Sexual Assault, thank you so much for joining us.
Thank you, Cole. I appreciate it.
We'll be right back.